Mucopolysaccharidosis. So we're looking at the diseases and the respective enzyme deficiency. So firstly we are looking at the Hurler or the Hurler syndrome, and the MPS involved is MPS 1, and the enzyme deficiency is MPS 1 is involved, and the enzyme deficiency, it is nothing but of the alpha L iduronidase. Next we are looking at what is the gags which are involved. So the gags involved include the sulfate, that is the dermatan sulfate, as well as the presence of the heparin sulfate. Now what are the symptoms associated with the Hurler's syndrome or the HS syndrome? So the symptoms include the mental retardation, there is a coarse facial features, there is presence of the hepatosplenomegaly, as well as there is a cloudy cornea which is present. Next we are going to see about the Hunter's syndrome. The Hunter syndrome, the MPS which is involved is the MPS 2, and the enzyme deficiency of Hunter syndrome is nothing but the iduronate sulfatase. And looking at what are the gags which are involved, glucosaminoglycans which are involved. So this includes the dermatan sulfate, the similar one, that is a dermatan sulfate, as well as the heparin sulfate. And next what we see is the symptoms. It is the mental retardation is prominent feature in the Hunter syndrome. Next we are looking at the Sanfilippo syndrome A. So here the MPS which is involved is the MPS 3A, and the enzyme deficiency is of the heparin sulfate in sulfatase. So the gags which are affected here are the heparin sulfate, and the symptoms, the gag affected is the heparin sulfate, and the symptoms include there is a delay in the development of the delay in development, as well as there is motor dysfunction.